Again, welcome to today. I'm very excited for today's event. We have a lot of good information to share with you. I just thought some color might be nice. So this is actually a drawing over here from my 4-year-old son. So just put that up to add a little bit of color since I'm doing these Facebook Lives from home right now with all the COVID-19 things going on. So thank you for joining me today. My name is Dr. Catherine Takeda Wong. I'm a naturopathic physician and acupuncturist. For those of you who aren't familiar with naturopathic physicians, like medical doctors, we must attend a 4-year medical school. We are trained as primary care physicians, and as such, I can order lab tests, write prescriptions, and do school physicals just like other doctors. But a big difference is that naturopathic doctors are trained in the power of nutrition to build health from the inside. They use personalized food recommendations, as well as vitamins, herbs, and other types of natural medicines to address the underlying causes of disease and treat the whole person. I also have a master's degree in Oriental medicine, which allows me to include Chinese medicine and acupuncture in my treatment protocols. Before we begin, I wanted to let you know that if you have health concerns that you would like to talk with me about, we are currently offering a free phone consultation called the Personal Health Strategy Session. This is a 15-minute strategy session where we can talk about your condition and come up with a plan to see how I can help you the most. Arranging a consultation is very easy. Just call our office at 808-425-2987 or text free consult to that number, or you can click on the contact button on our Facebook page. Either way, our staff will contact you to arrange a no-charge phone consultation. And you'll find all the contact information right here on our Facebook page. Let's get started, and please feel free to use the comment section to ask questions as the talk progresses. So there are a lot of concerns, I'd say, in our community now about environmental toxins, and that issue is only building. This is something that I see a lot in a lot of my patients, unfortunately. I have patients that are coming in with all different kinds of things that they are not getting answers to from conventional medicine. It might be things like chronic fatigue, chronic headaches, joint pain, a number of different things or also like significant difficulty focusing or paying attention, changes in mental function or memory, mood. And so when I work with people, I'm really trying to look at the underlying causes. So I will typically do very extensive testing to try to figure out what are the underlying causes. And one of the things that I see in all the symptoms that I just mentioned that are pretty common are environmental toxins. And there are many, many different environmental toxins. We won't have time, of course, to go over all of them. We're making this a 2-part series, so there's 10 top environmental toxins that I'm going to be talking about. There's so many. I'm going to just be talking about some of the big 5 today in our talk, and then in our next Facebook Live, which will be in 2 weeks, I'll talk about the other 5. So I certainly won't have time to go into a great amount of detail, but I'm going to try to touch on some of these toxins and just try to help to increase awareness about a lot of these toxins that can often have an adverse effect that I see very often in my patients, and to help educate you about the toxins that are probably lurking in your home and how you can be able to protect yourself and your family from them. So we are going to be talking about everything from arsenic to volatile organic compounds, which will be coming up in the volatile organic compounds we'll talk about in our series that will be in 2 weeks from now. But as I mentioned, I've seen a number of different health issues. Some other things that I've seen include insomnia or mood changes, also hormonal problems, infertility, and all are related to toxins that can be lurking right in our homes. So as I talk about each toxin, I'll explain a little bit in terms of some of the big things about what it can do to your body and then how to protect your family going forward. Today we will cover mercury, arsenic, and lead, which are some of the 3 most common heavy metals, and also mold and mildew. And then the last one we'll talk about is BPA, or bisphenol A. So just jumping into it, mercury. Mercury is a really big one. Most people are aware that mercury is something that is found in a lot of different sources. And most people have heard about mercury, but they often aren't aware of where they could be getting mercury from. So many of you may have heard that you can get mercury in big fish. So some of the really big fish are shark, swordfish, tilefish, orange roughy. So these are some of the really large fish. And the rule of thumb in terms of mercury is that the bigger the fish, the larger the concentration of mercury in the fish. Because what happens is that we, due to environmental pollution, have mercury that's in our oceans. Then that gets into the seaweed. It's absorbed by the seaweed, which then are eaten by plankton, which are then eaten by small fish, which are then eaten by bigger fish and bigger fish and bigger fish. And each time that they're eaten, then you have the levels of mercury increasing. And we see those levels increasing in the amounts of the tissues. So that's why the bigger the fish, the higher the concentration of mercury. So shark fin soup, definitely a really big no-no. And I tell people that really, especially if you are thinking of getting pregnant, or if you are pregnant, or if you're breastfeeding and you have a young infant, that is the biggest time I really say no large fish at all. There are some guidelines in terms of, maybe a little bit of tuna might be okay, but my recommendation is no large fish at all during those times, to really be on the safe side. So I mentioned some of the really large fish, but a really common one that we see is ahi here in Hawaii, with ahi poke and sushi and tuna. So the large chunk ahi is higher in mercury than the canned tuna. So that is one thing that it's really commonly eaten. And you see a lot of patients where they're eating a lot of ahi. They're eating every week, or large amounts, like several pounds, several times a day. And one of the things with that is that people don't realize that it actually really can accumulate. So I have a number of patients where I will test their mercury levels through hair as well as through blood and urine, and I like to test all of those different sources because we might have some things that might show up on some and not on other sources. But I've seen a number of patients where their blood levels of mercury are elevated, and they might be eating ahi like once a week, or once every 2 weeks or so. And they might not think that it's elevated, but I see that regularly where people's blood levels of mercury are above 10, which is the reference range, and we see a lot of issues coming from that. Also, aku here in Hawaii is a type of tuna that is high in mercury as well. So those are some of the other sources, some of those biggest sources. It's been found that even a single serving of a very large fish in pregnancy, like shark or swordfish or orange roughy or tilefish, is enough to significantly increase the risk of fetal abnormalities if a woman has just a single serving of a very large fish during pregnancy. So that's why I say absolutely none of the large fish, and I really encourage just don't eat ahi even, or tuna. Ahi and tuna are lower than swordfish or shark in mercury, but I have found it to be enough to significantly elevate levels where it is a risk for concern. Another source that we can see mercury is silver fillings. So the dental fillings or dental amalgams, you will release small amounts of mercury as you chew. So that's another source. And I've had a lot of conventional dentists that will say, oh no, it's fine, but I will tell you, I've had a number of patients where we test their mercury levels and they're high, and then they have their silver fillings removed, and then we retest them later and we found that their levels go down significantly. So that is certainly a source where I have seen symptoms from them. And when you remove silver fillings, you really need to make sure that it's done by a dentist who's well trained. They're referred to as biological dentists or green dentists. And so here on Oahu, I usually recommend Chad Kawashima or other dentists in his office, and also Tony Kim or Anthony Kim are two dentists that I refer to very often, and I've had a number of patients who've gone to them for proper mercury removal and found that that will be very, very helpful. I've never had a single patient who's had any adverse effects after a mercury removal from going to either of those two dentists. On the flip side, I've seen some patients who have gone to dentists where they were not properly trained in proper mercury removal, and the process of removal will release a lot more mercury into your system, potentially, if it's not done properly, because mercury will be released as a gas. And so that's one of the things that is really important in terms of reducing exposures, having a dentist who's really properly trained. One thing I will say is that if you are pregnant, or if you are breastfeeding, or if you're planning on getting pregnant in the next month or two, or trying to get pregnant, I really recommend that you don't actually remove those mercury fillings during that time, just because of the risk of potential increases in exposure. And I recommend that people just wait until after they're not pregnant anymore, or not breastfeeding, to remove those mercury fillings. And another source is broken fluorescent light bulbs, so including the compact fluorescent light. So all fluorescent lights do contain small amounts of mercury in them, and you aren't exposed to them unless the bulb is broken. Then mercury actually will go into the air as a gas, and you can inhale it. So that's one of the things that I recommend, is that people, first of all, try to avoid fluorescent light bulbs in the first place as much as possible. If you do break a fluorescent light bulb, including a compact fluorescent light, do not vacuum up any of the pieces, because when you do that, the mercury is going to then get into the vacuum, and it can then be excreted while you vacuum other places. Mercury can then be spread all over your entire house. So never vacuum up broken fluorescent light bulbs. The best thing to do is try to get a mask that you can wear, so that to minimize your breathing in any of the mercury vapors as much as possible. And also, in terms of the fluorescent light bulbs, getting gloves, so you can try to avoid getting exposed through your skin. So using gloves, try to clear out the area, cleaning it up with paper towels or things that you won't reuse. Throw them away, throw them in sealed plastic bags, several sealed plastic bags very well, and then throw them away. Don't vacuum up those broken pieces. So an alternative for fluorescent light bulbs are LEDs. So those are energy efficient light bulbs, and they do not contain any mercury. Or the regular incandescent light bulbs, they are not as energy efficient, but the regular light bulbs do not contain mercury as well. So that's another option. And what's the harm with mercury? So you can have fetal abnormalities in babies, developmental delays. If someone has acute mercury poisoning, they may have things like abdominal pain, also neurological issues like mood changes, irritability, joint pain, tremors, fatigue. We might also see things like hyperactivity, chronic headaches, memory loss, difficulty with sleep. So those are just a few of those things, that the effects that we can see. Another source also is that there are some vaccines that do contain mercury, or thimerosal. So all of the thimerosal were removed from the standard vaccine schedule, the standard vaccines that are in the regular vaccine schedule for children. However, one thing I will say is that the flu shot is one vaccine that does still contain thimerosal, even the one that is administered to children. Vaccines are another topic for another day. I know it's very controversial, but I just think that it's important that people are informed that there is thimerosal or mercury, very small amounts, but that still is present in flu shots, the ones that are administered to children, and that most flu shots that are given. And then there are other vaccines that are given to adults which do contain thimerosal or mercury as well in small amounts. So I think it's important just to be aware. And there are risks and benefits. So I typically will advise patients in terms of that. One thing is that with the flu shot, it is possible to get, if you get the single dose vials of the flu shot rather than the multi-dose vials, then the single dose vials of the flu shot do not contain mercury. That being said, I have yet to find a pediatrician's office or a pharmacy that carries the single dose vial of the flu shot because it's a lot more expensive. So I typically will, sometimes if people really want it, I might special order a single dose vial of the flu shot for them. So moving on to one of the other big heavy metals, arsenic. So arsenic, what are the issues that you could see with that? Very, very similar to mercury. A lot of the heavy metals cause really similar types of issues. So again, it can cause developmental delays in children or babies, can cause fetal abnormalities in babies if mom is exposed. Then acute arsenic poisoning can also cause very similar types of things: abdominal pain, irritability, joint pain, fatigue, memory loss, headaches, those types of things. So arsenic, where can you find arsenic? It is found in some shellfish. However, most of the arsenic that is found in shellfish is the organic form, which is thought to be not as harmful. And then it also is found in some types of seaweed. I did research into this, and when I looked through the research studies, the highest seaweed that contained arsenic, the one that was most significant, was hijiki seaweed, Hijiki. So that is the one type of seaweed that I will recommend that people avoid if arsenic is a concern or if they have neurological concerns. And then I typically recommend that they get their arsenic levels tested. So I will recommend testing and do testing on my patients. One thing that's really big in Hawaii is rice. So a lot of people are not aware of that, that there were studies. There was a study done by Consumer Reports where they found that rice was high in arsenic. And interestingly enough, brown rice is actually higher in arsenic than white rice is. Some of the thoughts are that the bran around it will absorb and hold on to more arsenic than white rice, which has the bran, the outer fiber layer removed. So I usually recommend that people try to moderate their rice intake. I usually recommend that people try to do more of other grains, like quinoa has a very negligible, if any, amount of arsenic, much, much, much lower than any of the arsenic that we found in rice, according to Consumer Reports. So there also are reports about fruit juices, particularly apple juice, that have arsenic. So what we'll be doing after our Facebook Live is we'll be posting up some links. We'll put up some links with some of the Consumer Reports articles with finding rice in the arsenic in rice, and some of the Consumer Reports articles on fruit juices, and some of the brands that they tested, and that some which had higher levels of arsenic than others. In that study, they also found that there are some fruit juices commonly that had lead in it as well, which is a huge concern. So, so that's one of the things, is that we'll put those links up. We have them all on our, we'll be putting up a link to a page that on our website that will have all that information. And apple juice and apples, there is a concern about arsenic. There were concerns particularly with arsenic levels in apples coming out of China. And they found, actually some years ago, Dr. Oz did a report on some apple juice, finding that some of the apple juices where they sourced apples from China had dangerously high levels of arsenic in it. And so if they're organic, that is one thing that will help to lower the levels of arsenic, because arsenic is found in pesticides and herbicides. So if you eat apples, I recommend that you, or drink apple juice, I recommend that you get both the apples and apple juice organic, and really avoid all of those kind of things. Mercury, as well as arsenic, and then also lead and a number of other toxins are also commonly found in drinking water. So we'll post up a link where I've done research on different types of water filters that have been tested to remove lead and mercury and arsenic, and that you can see those. In terms of water filters, my general recommendation is that people, if you're financially able at all, really trying to get water filters that are either countertop or under the sink models, because those will filter out a lot more than the pitcher filters or the ones that attach to the sink. Those are better. And then you can also get water filters that will filter out toxins and heavy metals from all of the water in your home. So those are called whole house or whole home filters, where they attach to the water at the source, and then basically all of the water, whether it's coming out of your kitchen or your bathroom sink or your shower, is then filtered. Those are quite expensive, but I tell people at least to filter the drinking water, that the water that they're drinking and cooking with. And people think, oh, well, I'm cooking with it, so it's okay if I don't filter it. And that will cooking will kill bacteria. However, for heavy metals like lead and mercury and arsenic and a number of other toxins, they are not things that will be killed, or they will not break down with heat. So lead, mercury, and arsenic are naturally occurring heavy metals. They are basically a type of mineral, which is very heavy, and heat will not break it down. So you really do need to fill a good water filter. And people ask, well, can you just drink the tap water? I really recommend that people don't drink tap water. I really recommend getting a filter. Particularly here in Hawaii, areas where there was a lot of agricultural work before, with sugarcane or pineapple fields, those were treated with high amounts of pesticides and herbicides back in the day, and arsenic is certainly very high in pesticides and herbicides. So particularly if you're living in an area where on Oahu, where there were a lot of sugarcane or pineapple fields in the past, you really especially want to make sure that you are filtering your water, because they have found significantly higher levels of arsenic in the ground in those areas than in non-agricultural areas. So again, trying to decrease your intake of rice, looking at the fruit juices. I generally recommend just water anyway for most drinks, rather than juices, and then doing quinoa and other grains that are lower in arsenic. Lead. Lead is another heavy metal. Most people are very familiar with it. A lot of the side effects from lead are really similar to the ones that I mentioned earlier for mercury and arsenic. And one of the main sources were lead paint. So basically older houses that were built before 1978. That can be a concern. So in 1978, the United States government banned lead in paint, but houses that were older than that did use lead paint prior to that time. So people say, okay, well, you paint over it with non-leaded paint, and that is true. So as long as you have several layers, ideally of non-leaded paint, you shouldn't be exposed to it. But where it can be an issue in older houses is around the windowsills, because the windows are going up and down, and then that will tend to crack and chip the paint, and then you can get exposure as the newer paint chips off. Then you can get exposure to lead from the old paint that chips off, and then you can get basically very small paint chips that can settle on the carpet, or even worse, get into the air, become part of the dust that can then be breathed in. Especially babies who might be crawling around, touch the windowsills, put their hands in their mouth, and they can get lead exposure from there. And that also, if they're basically in areas like in daycares or older homes. So some of the things that you really want to make sure is as much as possible. If you do live in an older home, or your child is in daycare or in older buildings, really try to make sure that you paint over the area with non-leaded paint, or like especially around those areas that there is fresh paint on there. And ideally, especially if you have babies or young children, if possible, trying to move from that place to a newer home is ideal, if possible. So again, just to let you know, we will be wrapping up soon. I want to remind you that we are offering a free phone consultation to talk with me personally about any health concerns that you may have. Arranging a consultation is very easy. Just call our office at 808-425-2987 or text free consult to that number, or click on the contact button on our Facebook page. And our staff will contact you to arrange a no-charge phone consultation. And you'll also find all the contact information right here on our Facebook page. So moving on to some of our last two toxins, mold and mildew. So mold and mildew are both a type of fungus. And what happens is that they release toxins into the air. And this is really much more widespread than people realize. There are tests that we can do to see if people are having an inflammatory reaction to mold, particularly, or mildew. And there are also tests. There's a urine test that can be done that will check for levels of what are called mycotoxins, or toxins from mold. And so basically, if you have mycotoxins or mold toxins in your body, then a normally functioning liver will get those toxins out, and you will see it coming out through the urine. So that is one way to check to see if you are currently being exposed to mold. If someone has issues with their liver being able to appropriately get those toxins out of the body, sometimes we see that those toxins are not elevated in the urine. And what we have to do is we have to make sure that someone's detox pathways are working well first, and then we can retest and then see if they have levels of mycotoxins or mold toxins. What are the things that we can see from mold toxins? There are a number of allergy symptoms. So those are pretty widely known, that people can get things like itchy, red, watery eyes, or nose, or sneezing, even wheezing, asthma. However, I've also seen other kinds of things: chronic headaches, where there's no other clear explanation, memory loss, body aches and pains, changes in mood. I have seen particularly children with autism who are very sensitive. I've seen some of them have very severe reactions if they are exposed to mold, or if they move into a home that's moldy, or if they're exposed in school or things like that. And so definitely checking all around as much as possible. Mildew, we are often aware that those will usually grow in the shower area. So you can use hydrogen peroxide. I'm generally not a fan of bleach, but especially here in Hawaii, I find that oftentimes that's one of the only ways to really kill the mildew. And bleach, it does have toxic compounds too. So I usually recommend that if you're going to use bleach, trying to get a respirator mask, or N92 N92 mask that you can wear while you're spraying it, and then trying to open up windows, or trying to spray it where the rest of the household will be out of the house, so that they won't be exposed until the fumes have kind of cleared from that. But often mold can grow in sofas sometimes, or behind sofas, or behind beds or furniture that are rarely moved. Checking underneath carpets, checking inside of your AC if you have an air conditioner, because mold can grow in there. And that can be something where you may see reactions, say, when you turn on the air conditioner. And so it can be very helpful to have a good quality mold expert come and do a thorough inspection of your home if you're suspecting mold. And there is something called CIRS, or chronic inflammatory response syndrome, which is basically what happens is that you are exposed to mold, and that triggers your immune system to go into this overdrive reaction. And then people can get a lot of different symptoms from that. And there are specific ways that we use to help to detox people from those mold toxins. And so tests can be really helpful to see if mold is possibly an issue for you or your family. Protecting your family from mold and mildew, again, just trying to clean as much as you can. I know in some areas of Hawaii, like Hilo, or the windward side of Oahu, like Kaneohe, that are very, very rainy, it can be extremely hard to completely get rid of mold. I have some patients in Hilo where they are cleaning constantly, and as soon as they clean out one area, then they find another patch of mold in their home, so it can be extremely challenging. But as much as possible, trying to keep the mold and mildew at bay. And if your health symptoms get really severe, the best thing is to try to remove yourself from those sources of exposure. So for some people, that will mean moving, if they really just can't get rid of the mold or mildew. And then again, there are specific ways to help detox the body. And if you have questions about that, you could just call our office and we can schedule a free phone consult, and we can talk more about options with that. And then the last one I want to talk about is BPA, or bisphenol A. So BPA, most of you have probably heard about BPA. Bisphenol A is a man-made compound which is used in plastics and in some other sources too. But BPA is used to modify the properties of plastic. And so BPA is associated with a number of different issues. So research studies have definitely found that hormonal problems are highly associated with BPA. So things like infertility or erectile dysfunction, prostate cancer, or other types of hormonal reproductive problems have all been linked to BPA exposure. There are certain types of cancers that have been associated with exposure to BPA, heart problems, and there also are a number of research studies which find early evidence for a link between BPA and things like obesity, diabetes, ADHD, and autism. So there are a number of different things that have been associated with BPA. So certainly you want to try to avoid those. So BPA, you can find BPA, one of the most common ones is in plastic bottles. And so a lot of people, a lot of my patients even, they come and they're drinking water out of plastic bottles. And I tell people, really, I mean, like, just don't drink out of plastic bottles, especially the small disposable, the soft plastic ones, because the soft plastic ones, the BPA, and there are a number of other toxins besides BPA, where toxins will leach out of the plastic and it will leach into the water. So that's one of the things that you really want to be concerned about. So again, I really just recommend people just don't drink out of plastic water bottles. And a lot of people get their water with like the Menehune water, or those big plastic jugs, and they're harder plastic, so those are better than the soft plastic, but you will still get BPA and other toxins from plastics that will leach out into the water. So I really recommend trying as much as possible to avoid those, and instead getting a really good water filter and just getting a stainless steel water bottle or glass water bottle, and then drinking out of that rather than out of plastic. And one of the things that they have found, there's an issue, we'll talk about this in the next Facebook Live a couple weeks from now, a little bit more in depth, but there are concerns as well with microplastics. So microplastics are basically these tiny, tiny microscopic plastic particles. So they're so tiny that you can't see them with the naked eye. But basically they have found microplastics, these very tiny microscopic plastic particles in almost all the different sources of drinking water in terms of bottled water. So they found higher levels of microplastics in bottled water that was in plastic bottles. However, a really disturbing thing is that they did find even some microplastics even in the bottled waters that were in glass, because some of the sources that were sourced from, we find microplastics in there from ocean water and in lakes and rivers, just due to all the plastic contamination in the environment. So a good quality water filter will filter out microplastics. So that's another reason to get a really good quality water filter. And we'll post up some links afterwards about those. So, so that's, again, something that's really important. And then also you will find BPA in canned goods. So they use BPA to line canned foods or the cans to prevent the metal from rusting. And so trying to avoid canned foods as much as possible. And I usually recommend that if possible, people try to get their food like fresh or frozen as much as possible, and then trying to put them in cloth bags rather than plastic bags. And for the there are BPA-free cans. However, there are concerns about some of the things that are used to replace BPA can actually be just as harmful. There's other types of bisphenols, like bisphenol S. So other types of bisphenols that are used to replace BPA that actually have been found in research to be problematic and sometimes even more harmful than BPA. So trying to avoid cans as much as you can, and trying to get fresher or frozen food. I understand a lot of times the frozen food is in plastic. It's pretty much impossible if you're living in the modern world to avoid all plastics. But one thing that you can do is when you get home, after you buy foods, if they're stored in plastic, then you can try to transfer them out of the plastic containers into like a stainless steel or glass container. And then trying to get rather than plastic food containers or the Tupperware, trying to get more of the stainless steel or glass containers. So I'll put links up to some of my favorite products, and in terms of food storage or other kinds of things that you can use. And then also cash register receipts contain BPA, so trying to avoid using the cash register receipts, or you can just request not to get a receipt, or if you do use them, then trying to basically trying to throw them away and wash your hands as quickly as possible. So those are some of the big ones. Those are not all the sources of BPA, but those are some of the biggest ones. There also are some dental sealants that contain BPA, so asking your dentist to use BPA-free dental sealants, or using other materials like gold fillings is another option. Also, plastic bottles, people think about like infant bottles. So for my sons, we got stainless steel bottles for them rather than plastic baby bottles. Compact discs will have BPA on them as well. So again, as much as possible, trying to avoid them. Definitely never microwave food in plastic containers, because if you heat the plastic, it will leach more of the BPA and those toxins into your food. So never microwave or heat foods in plastic containers, and really try as much as possible not to store hot foods, especially in plastic containers. Try to put them in glass or stainless steel or porcelain containers as much as possible. So again, those were some of the main things. But, you know, so hopefully you receive some good health information to help protect you and your family from 5 of these harmful toxins. We've talked about mercury, arsenic, lead, mold and mildew, and BPA. And it is important to take these toxins seriously, but not to get overwhelmed. So yes, we should work to remove them from our home, but we don't want it to stress us out to the point that you know you can't really do anything. So what works is to start with what you can do today, and then make a list of the things that you want to do over the next few weeks and months, and then just get started. And just taking action is motivating. So again, we'll be posting up links that will be helpful, and let us know if you have questions. And if you would like to arrange a personal health strategy session, our phone consultation for people who are interested in talking with me one-on-one, we're offering it for free. Just call our office at 808-425-2987 or text free consult to that number. And you'll find all the information on our Facebook page. You can click on the contact button and then also arrange a phone consult with us. So mahalo, and I look forward to seeing you in 2 weeks. Thank you.